This is the most effective treatment that's ever been shown in treating the leading cause of death and disability, which is high blood pressure. It also reduces insulin resistance. It can enhance cognitive capacities, and you also see it affecting things like depression and anxiety. It's called fasting, and there's more. In lymphoma, case reports on a young woman, and she continues to be cancer-free. So I've spent 40 years helping people get healthy, and I can tell you that I think you should be fasting every day.
What is the protocol for refeeding them?
They're back to a whole plant food, SOS-free diet, the kind of diet that we want them to sustain forever. Cure just means you're alive 5 years after treatment. It doesn't mean that you've actually resolved the underlying cause of the condition. But if they go back to eating the greasy, fatty, slimy, salty, processed food, it'll come back.
Hey everyone, so recently saw on Diary of a CEO, the massive podcast, there's a story of a lymphoma cancer patient who reversed her disease through fasting and a whole food plant-based diet. Let's go to the clip.
In lymphoma, which is a type of cancer, we published a paper in the British Medical Journal, case reports on a young woman who had follicular lymphoma, had progressed for a couple of years. Her oncologist told her the diet didn't matter. The diet wasn't related to, this particular type of cancer. She could eat whatever she wanted to. But nonetheless, she decided to come in rather than go through chemotherapy and underwent fasting. And we did 3 weeks of fasting, during which time you could literally feel these tumors disappearing. She had her follow-up CT scan, and at a year, we submitted this case report. And it was interesting because BMJ said, well, maybe she got lucky. I mean, yes, it progressed for 2 years. Yes, it went away in 21 days of fasting. But maybe, it was just naturally the time for it to go into remission. A small percentage of lymphoma patients do go through spontaneous remission. So they said, why don't you follow her for 3 years? So we followed her for 3 years, and I told her that she had to stick strictly to the dietary protocol, or it would be fatal because I'd track her down and kill her. And she did stick to the diet, and at 3 years, we have CT evidence that she was cancer-free, and we submitted that. And then we followed her for 10 years, and she continues to be cancer-free. And she continues to follow a whole plant food, SOS-free diet.
What I don't want if people watching Stephen Bartlett's episode, right, I don't want them to think, oh, this is just one anecdote of this one person and yet it happens to be published. No. The power of specifically plant-based nutrition goes back decades. The longest lived cultures around the world hardly got cancer. They're consuming a predominantly plant-based diet.
This is not really offered to people. It's like, cool, sign up for your chemotherapy. That's all you get. Off you go. Done. If it works, cool. If not, maybe we'll try something else. We'll do a surgery. These things aren't really offered.
Now we've published a case series, which is a series of lymphoma patients, including one particular gentleman that was even more progressive. It was the stage 4. It had already metastasized into the bones. He had failed chemotherapy. He also did well. But he came in, he did the treatment, did well, went back to the oncologist who said, wow, that's really impressive. Why don't you go back and do some more of that? He came back, we did another 39-day fast, and he was able to get dramatic improvement. And again, those studies have been published in peer-reviewed journals.
But he didn't go into remission?
With lymphoma, it would be considered remission, but it's not a cure. It's just like you can't cure lymphoma any more than you can cure obesity. You can lose the weight and keep it off, but if you go back to doing the things that cause it, it's coming back. You can't cure high blood pressure. You can normalize the pressure. I've got people who've been normal pressure for decades now. But if they go back to eating the greasy, fatty, slimy, salty, processed food, it'll come back. The whole concept of a cure is a little bit of a misnomer. In medicine, cure just means you're alive 5 years after treatment. It doesn't mean that you've actually resolved the underlying cause of the condition.
We have the capacity to heal. And I think he does this so well. He talks about actually like healing the system, removing the stimulants that can cause the disease and actually treating the body through food. I mean, don't try this at home, kids, but it's definitely possible to have a medical doctor that can mediate disease and sickness through food. I actually don't know if you've ever heard of Dr. Baxter Montgomery of the Montgomery Wellness Center. He recently passed this year, but Dr. Baxter Montgomery was a very good friend of mine and also created a clinic much like this in Houston, Texas. And so he would have high-risk patients come into his clinic for 30 days. They would undergo a water fast. He would start introducing juicing. He also had a whole food raw kitchen attached to his wellness center. So people could come in and go shopping. They could grocery shop. They could come and have their meals every day. And this is exactly what they found. I mean, it just transformed people's health.
And when you finish a long fast, like a 40-day fast, or even a shorter fast, like a 5-day fast, what is the protocol for refeeding them?
They get a day of fresh fruit and vegetable juices for every week of fasting, more or less. So they're going to get about 600 calories of fresh fruit and vegetable juices if they had a 3-week fast for about 3 days. The idea is that we want to introduce initially food without fiber, so if there's any digestive challenges, that's short-lived. We want to introduce food starting in the morning rather than at night, so if there's any challenges, it doesn't disrupt their sleep. We want to make sure that they're rehydrating and getting some glucose without necessarily overloading their capacities. Once they've acclimated to the juices, which are relatively easy to absorb and bring up blood sugars relatively quickly, moving them out of the fasting phase into more of a feeding phase, then we'll introduce raw fruits and vegetables, which introduce some fiber. And then we'll introduce more concentrated foods like steamed and starchy vegetables until by half the length of the fast refeeding, they're back to a whole plant food SOS-free diet, the kind of diet that we want them to sustain forever.
No one makes money from you eating whole food plant-based.
That's so true. But like, imagine how many more people could be saved and like costs to healthcare prevented and all this kind of stuff if this was widely accessible information, which to be fair is why I'm really happy it actually was on the Diary of a CEO. I know like they've come under scrutiny for sharing all sorts of different health stuff, but this is one where I'm like, this is amazing to get that to the masses and actually explain it in quite a detailed way.
Well, he took down Dr. Neil Bernard, the interview he did with Dr. Neil Bernard, which I thought was a phenomenal episode. I believe that was earlier in the year, and clearly has some kind of magnetism towards low carb patterns of eating. However, I believe his fiance or girlfriend is or has been plant-based. And so I think he is doing a good job at having, Alan on there. I noticed when Dr. Alan Goldhammer talked about plant-based, Diary of a CEO, Stephen Bartlett kind of tried to push it back and nudge it back to fasting rather than getting into nutrition, which I thought was interesting. I think Alan did a good job of reiterating that it's a whole food, plant-based diet that he recommends.
But after fasting, whole plant foods start to taste good. And the longer you eat them, the better they taste. You get to the point where you actually would prefer to eat whole plant foods rather than the salty, greasy, fatty, processed foods that everybody else is eating. So these are big changes that occur in fasting that are not necessarily as easily objectified from a research standpoint, but have a profound difference on how people feel and how they live their lives.
When I was on a ketogenic diet, things tasted sweeter. But when I came off the ketogenic diet and I started having carbohydrates again, those drinks didn't taste so sweet anymore.
But it's your palate that changes. The ketogenic diet is a fasting mimicking diet. It mimics some of the effects of fasting, not the least of which is changes in taste, what's called taste neuroadaptation or sensitivity. Mm-hmm. And it's not carbohydrates that desensitize you, it's refined carbohydrates. Mm-hmm. And so if you get people on a whole plant food diet, fruits and vegetables, whole simple foods, they maintain that acuity of taste. But as soon as you put them back on refined carbohydrates, the processed carbohydrates, then they begin to go back into the dietary pleasure trap.
20 years ago, Dr. Dean Ornish published research showing you can reverse the progression of early stage prostate cancer. And I actually want to go to a clip from Dr. Dean Ornish 20 years ago when he was talking about this.
I want to tell everybody, first of all, you had 93 men. You followed them for a year. They divided into groups and volunteered, some of them to continue with their regular diet and lifestyle, and others to adopt a different one. Let's talk about the different one. It's very dramatic. It was a vegan diet.
We took 93 men. We randomly divided them into two groups. All of them had biopsy-proven prostate cancer and had elected not to be treated conventionally. That way we could compare them to a group that wasn't getting any treatment. What we found is that after a year, the men who followed a vegan diet and who also made other changes in diet and lifestyle, who exercised, who did yoga meditation, and who had a support group, that their PSA levels began to decline. PSA, as you know, is a marker for prostate cancer. whereas the comparison group, they went up or got worse.
But this was
Right.
just 6%. Does that mean that this is still just marginal and speculative?
If PSA is declining, or even if it's not rising, it means the prostate cancer is not spreading. And if it's not spreading, you're more likely to die with it rather than from it. And so to that extent, it's significant. But we also looked at some other markers. We found when we added the serum of these patients to a standard line of prostate tumor cells growing in tissue culture, the actual inhibition of the tumor growth was 70% in the men who made these changes versus only 9% in the group that didn't.
Can anybody stick to that diet? A vegan diet is tough. That's no eggs, right? That's tough.
Well, it's compared to what? I mean, again, these are for men who have prostate cancer who are trying to reverse heart disease. It requires big changes in order to get that. It's one of the reasons why no one showed it before is because they didn't go far enough.
Big news this morning, and I remember the skepticism that greeted you when you talked about reversing heart disease.
Even 20 years ago, this was a major problem among men. 20 years later, it's still a major problem among men, except for now, 20 years later, what we're finding is the leading cause of cancer is colon cancer under individuals age 50 and younger, and that's for both men and women. And so we're seeing different types of associated GI tract and colon cancers, which tend to be heavily associated with lifestyle factors.
But I think Dr. Ornish has been successful because it's not just exercise and diet, it's love more and stress less. And I think that's key for a couple of reasons. Firstly, if you make it multifactorial, it kind of like it destigmatizes it. It doesn't make plant-based a defining thing. The other thing is like it happens to be true. Like it really does affect.
You know what? It is one variable. It is a multitude of variables. And the thing is, we don't know the combination or how much of one variable versus the other will have an impact on one particular organism. And that's going to differentiate between a variety of people or a variety of populations. And that's why we need human research.